There are currently 45,000 traditional healers in the country. 70% of the healers are located in rural areas where they are consulted. Unfortunately, most of these traditional healers are ill-equipped, affecting quality care delivery. Despite effort by government and NGOs to collaborate with traditional mental healers to improve the status of traditional healing system in the country, there is still much to be done. However, there is no doubt that herbal and spiritual methods of treating persons with mental illness by spiritualists play a vital role in the treatment and cure of such people. In recent times, there has been report of some mentally ill and epileptic patients being chained and confined to isolated places, beaten or bathed with hot water during treatment, while females are sexually abused by some caregivers, herbalists at their treatment centers. Currently in Ghana, mentally ill patients suffer a high level of stigma in society. This situation has made life uncomfortable for persons who have been cured of mental illness in communities. A victim of mental illness, Edis Fusheni, tells me about the stigma he faces in society after going through mental treatment.
I have this attack, when I have this problem, I don't know what happened before I realized I was here. It took me some months before I recovered. And because of that, I don't work with people. Because they said I'm mad, they didn't give me work. But he's the only person who take care of me and give me work to do.
So how do you feel when each time you go to town, how people react to you, people who have seen you?
Some people do call me madman. So they call me madman, up to date. The people call me madman. And I say, oh no, I don't get time for that because I live with the mad people and I enjoy with them.
Dr. David Abdullah of Shekina Clinic in Tamale, who cares for over 120 mental patients every day, said the basic needs of mental patients are water and food since society sees them as a curse.
But on average, in our community here, mentally ill people are often thought of as accursed people. Some people think it's because of their past deeds that God is punishing them, and they may think otherwise of them, but usually negatively, so they do not get the support that they need. And their most basic need is food. From our experience, water and food are most important for mentally ill people, not even clothing or shelter. And these things are what we are addressing. And when you address a person's most basic need, the person feels cared for, the person feels loved.
Recently, 250 traditional mental healers in the northern region were sensitized on the new mental health bill and the need to harmonize the treatment administered to patients. The Knowledge Communication Officer for Basic Needs Ghana, Fred Nantoma, and John Ibrahim explains the essence of the collaboration between the traditional healers and the Ghana Health Service in Tamale.
Whether we want to accept it or not, our people still hold certain beliefs. Whether we want to accept it or not, our people see traditional medicine as efficacious, and so they would constantly send their people to traditional healers. Our task is to make sure that, one, the medicines are properly tested to make sure that they do not have any side effects or they are actually good for consumption for our clients. Two, that they live up to a certain standard of practice where the health of our constituents, that is the mentally ill people, would be better protected.
The traditional healers to admit that both of us can come together, we can care for a patient to become well, and that is what we are doing now. To bring them to the treatment of medical treatment, because some of them are refusing to admit the medical treatment, like chaining, bangling, tying them to other places, beating them, spraying hot water on them. Some of them have the delight in that thing, and that is what the mental bill is not allowing. So that's why we are educating them that it is not true, and some of them even maintain that if we use the medical treatment with their medicine will not work. So we are educating them that they should understand and allow us also to support them.
The Northern Regional Chairman of the Traditional Mental Healers Association, Alhaji Fusheni Alhassan, bemoaned the maltreatment of some mental ill persons, especially women in traditional healers' home. He therefore called for a stop to the practice.
Nta barma ka barma tabtana ka muso shebe pago mun barma za do mi azan barchante tam ko tulun pacho ya azan barchante ko buro mi febro kay na karla zan ka febto danse kala la nyele bi onon pa bia ya ka tibro ka zon le badi a pa on voro kera de tabi bi ya pa kamal course ngora bon ka pa ban tabla bam vo da ma kera badu.
The program coordinator for Gbom Katmale Society, a local NGO based in Tamale, promoting the welfare of mentally ill patients, Sheikh Yakubu Abdul Karim, urged the public to show love towards mentally ill patients since the illness is not infectious but can be treated.
Because if you were either suffering from mental illness or epilepsy, even within the family, you were neglected, you were marginalized, your rights were not respected. Because they eat alone, they were not consulted, they have no access to any information because they are vulnerable, they are sick. So it has come to time for us to rethink that these people or these sicknesses who suffer from mental illness and epilepsy can be treated. It is not infectious. And that has been the mentality. When you come across a mental ill fellow or an epileptic patient, then you will also be affected. So we are saying that please let us show some sort of love. Let them know that they also live in society. Let them participate in decision making. We've started the process. And let the stabilized ones, especially the children, we have enrolled over 50 children, stabilized mental ill children in school now, and they are performing well.
Nash for Versa One News, Tamale.